Good morning, Honorable legislator Pascalinah Kabi. I work for Uncensored News, and today we are honored to have you on our show. We are seeking your reaction following our story, Dr. Mokhothu, the Acting Director of Mental Health. But before we get there, I want to ask you, 4 years since you were in Parliament, Chair of Chairs, how has been the journey?
The journey has been both interesting and hectic. It has been something that I never thought it would be. It has been a journey filled with contradictions. It has been a journey with huge challenges that I never thought I could face. It has been the journey that made somebody to doubt the expectations that some of us had when you came into the place. It has been the journey that has made me to question the systems that have been established to run our institutions, to run the government ministries. It has been the journey that has made me to question the politics of Lesotho and their intentions. It has been a journey that helped me to see the possibility of a country that can manage its health systems in a very proper way. It has been a journey that has made me see the possibility of a country that can change its economy to better. It has been a journey that has given me the peep into that it was possible to eliminate poverty in a country. So that's why I said it has been a journey that is filled with contradictions. But also it has been a journey that has made me to believe one of the quotes from Nelson Mandela: poverty is a man-made thing. So it has made me to believe this is what we are doing politically. Because if it was not man-made, we would have stopped it. The resources which are within our disposal are enough to eradicate poverty for the 2 million people, are enough to make a development, are enough to make a value change that can change the trajectory of the country in a shorter space of time. It's from wool to variety of commodities like the poultry, the beef, the vegetables, the fruits, textile. Looking at that, it has given me at least an idea, vision that this could be ending. Yeah. Actually. So it also has given me an idea, the journey has given me an idea of the impact of corruption in all this. Because all this that I'm mentioning, they don't need anybody, they don't need donors, they don't need anyone. They have been obstructed by corruption. Corruption competes with that desire to level the playing ground for all the people. The corruption says, what about if I do it myself, the Pascalinah? This will enrich us and our families, not the nation. So these are some of the things that in brief, in summary, maybe we'll talk it someday, that in summary that it has given me. So you can imagine I will leave this very much confused in my mind. And also it has given me one last part, controversial as I may say it, that I realized for the first time that I don't have enemies from the opposition. I may have adversaries here and there, but I don't have enemies. Your enemies can be the closest people to you, the people on your same party. Because when they become the enemies of the good principles, of the good governance, then they become
your enemy.
You have to fear. So then there's a saying that says there's much to fear within than without.
Yeah.
So it relates to the party that the enemy is within, it's not outside. But also even the country, the enemy of the development of Lesotho, a good health, good education, and then all that, is not outside, it's within.
Yeah.
So I wish Lesotho could be aware that their enemy is not anything external, it's within. Why the people are still hungry, why the people are still so much unemployed, it's not outside, it's within. It's something that we are doing and promoting on a regular basis from elections to elections. So the politicians know that if you, they told me, they said, no, you can't be in politics if you are too honest to the good principles, to the truth. They tell me that you're not a politician, you're not a good politician, you're not supposed to be here. My own fellow politicians, they said, you're not supposed to be here. Why? You're too honest on the issues. The politics don't need, the people don't want the truth. So Basotho will have to think, is this the way we'll keep on going and ongoing?
As a journalist who has done a lot of work on politics, I shouldn't be shocked to hear you say this, but surprisingly I feel shocked, I feel scared for my country. Where does health fit in all these contradictions that you have mentioned? Because at Uncensored News we believe that when you are from a healthy environment, chances are very high that you lead a healthy life.
Yes, exactly.
So this is why we specialize in health and environment, and we want to understand where does the two sectors fit in all of these contradictions, in all of this corruption, self-made poverty, individualism. Where do we fit in?
Yes, one of the things that maybe it's very bad was the notion that we thought if people are from business, they will not take money from the public coffers. I think that was one of the illusion that we had. We thought they will make 𝗍𝗲𝗹𝗹𝗀𝗃 easier. 𝗍𝗲𝗹𝗹𝗃 easier. But it's not happening that way. I think we are very selfish in terms of that, if you look at who are getting all these things. So I would like to put it that way. So I would say, where does health stand? That's where the issues of mental health, which are very developmental issues, are not prioritized. If you see over the 4 years, the tragedy of mental health institutions, mental health policies, has been on our place for a long time. Simple things which do not need money, some of them. Some they need us to allocate money. But you haven't seen much of advocacy on that. Because on the scale of things, they don't attract much popularity. If you do those things, you just have to do them because it's a principle. Not because you'll gain anything. There's nothing to gain. So if you look at things, people go where, if I do this, I'll gain the popularity, I'll gain the votes, I'll gain the favor of the people. So, but unfortunately, the people with mental health are not in that position, or are not considered to be in that position. That's why when you look at the report of the Ombudsman, the legacy of negligence. If you look at that report, it's a painful report.
It is.
Very painful report. And when she ends that report, she says, this is a difficult report. She says it's difficult because it's a report that does not talk about statistics, it talks about the real lives. So I will say, my journey for 4 years brings me to the issues of mental health that we have not addressed adequately, even though we have seen them. But now, recently, looking at the other researches which have been made, that tells us the mental issues will keep on increasing. We are looking at the issues of alcohol in the country, drugs in the country. We are looking at the GBV in the country. All these things, we have seen that one of the things that they also produce is the serious mental issues in the country. While we don't have a clear strategy on that, and we don't have facilities to help the people, it means we are having a huge proportion of the people that will be lost. But people who have been killed by depression, the numbers are going high on a regular basis. Recently there was a research which was done by Wits University in terms of the places like 𝗿𝗁𝗃𝗃 and then 𝗍𝗃𝗃𝗃 in Tiwa, where they did an assessment of how many facilities of beer drinking are registered and how many. So they were saying in this particular place there are 13 that have been legally registered, but the ones which are operating are 34. And then they are supposed to close at a particular time, they don't close in that way. And they were looking, they said, now they also measured GBV in those areas. The numbers are very high. The rapes are very high. So when you look at the rapes, what they have done to many people, they've destroyed the mental capacity of many people. And those people find themselves in mental institutions. Yeah. So I think it has got a huge impact. Weak way of running the country destroys a lot of minds.
You chair the Social Cluster Portfolio Committee that some of the ministries that you oversee are the Ministry of Health. Very unfortunately, we sit here, the Department of Mental Health in the Ministry of Health receive not even a fraction, a very small little budget to run their activities. I think it's around 350,000. What is the role of your committee in influencing ministries to increase such allocations? I know that the ministries come with their own allocations, you approve, you propose, but how far can you go to influence that change?
Well, what should change that is an evidence-based information which comes even before the budget, so that when the budget comes we question. You said this is a priority, you said these are the issues, but it should reflect on the allocation of funds, but it's not reflecting. So that's how it's supposed to happen because of the system. Because the system doesn't allow us to budget to do those. It allows us to approve or disapprove. It doesn't allow us to reallocate the money even if they have not put it. So, but the information, like the one that is coming, the one that I saw a huge advocacy that Dr. Mokhothu has made on the mental health, those are very helpful. But it would be good that maybe we get it to the Parliament in writing so that we can say this is our reference. Where is the budget for this to address this? How long? The issues of mental health, we got them since we came in 2023. Blue Cross, the issues of Moshomi, and we sat down a couple of times and the minister said we are working on that. So I think now it should be a deliberate action that we said, please go and deal with this and come back within this shortest time. You may not believe it. Sometimes when we do that, the minister feels that we are micromanaging them. I think those are the challenges of the systems now. Yeah, sometimes they feel that we are now micromanaging them. So as a result, they end up not doing some of those things. Yeah, so those are the challenges that the Parliament has as an oversight. But now that the Ombudsman has written before and now has made a follow-up report, I think that calls for a very serious action for the minister to prioritize things. Recently I went there and I also asked them, said, please, when the budget is submitted, prioritize it, at least 3 things that we think they should be done. Otherwise it will be a disaster. they have to be done. But unfortunately, even the strategy is still lacking. We're still waiting for the mental health framework. So we can see that we delayed also even ourselves to keep on requesting this. But not only that, health is in serious troubles and problems because we don't have the strategic plan. They have promised that by December 2025 it will be there, but it has not been there. So those things also, you can't see what is it that they have prioritized if you don't have a strategy. So unfortunately we have to pass the budget without it, because sometimes we will say if we don't pass the budget when we have been requesting that, then it also affects the lives of the people. Yeah.
So what good does it make for Parliament to discuss mental health issues? Because recently Makhalanyane brought a motion before Parliament where we were discussing the state of mental health in the country. But for a Mosotho that is sitting and watching Parliament debates, really what the frustration is and common goal, how do we address this? A concrete answer. What good does it have? It's worried about the state of mental health, the cases. Why should we care? Why should we say towards these issues? Yet at the end of the day, you have these frustrations, you have the systematic issues that you are unable to
Well, I think it's just cause for Basotho to be aware that the systemic issues in the governance are also contributing a lot to lack of services and to lack of oversight or impactful oversight. Because we discuss it here and then that resolution is passed to the ministry. But the ministry takes the vision, takes the leadership, takes the priorities. That thing is included in their priorities to be brought here and then to be funded. Yeah, because even if you can talk, if you are not funding it, the people are just frustrated, said we'd like to do this, but we are not getting the funding. The ceiling doesn't allow us to do this and that. Yes. And then eventually we find ourselves in talking about things which are not happening. So the people become very frustrated who are trying to do the interventions. So, for me, I would say one of the things that we think should happen is concerted efforts of making sure that we can say from the social cluster of things in the country, what are the priorities? What is it that we are leaving, we're not putting into place from the other services of the government, so that we have more like a plan of the country? Because even when you look at NSDP 2 extended as it is, we're not able to say, but what are the real priorities of this country to alleviate the suffering, to alleviate bad service delivery on a particular social compact? What are the things that when we have done them, they will be done, and it's a once-off type of capital, and then that the system can now function better thereafter, but it has called economic results that you can see that because we did this. Go, for instance, they say sometimes said, if I pay this 100 rands, it should have saved the lives that contributes to 300 rands. So if we are not able to quantify, we'll always look at things as an expense. So if it's an expense, we said no, it's not a priority. The people with mental disease may not die that much. We are not getting much of the result that they are dying. We are hearing that they are alive, because sometimes when they get too sick, they go home in silence and die in obscurity, and nobody sees that. So it doesn't appear like TB stats, HIV stats, cancer stats. It doesn't appear like that. Yeah. So but if we had also a very good analysis of things. It would help us say if any one person who is mentally ill and is working and lives that income for that family, that skill that the country has developed, this is the loss. But if we were to intervene, this is the cost of saving that. Yeah, I think maybe we could see it different, but also value life. If we were to value life like the Bill of Rights says, maybe it could have given us a different view on the issues of mental health. Yeah, so the issues of mental health also, it's about the law. Our laws are old, very outdated around some of these issues. Things have developed a lot, institutions have developed, medicines, all these things, but the laws in health, public health laws, are very much backward. We've got the laws up to as old as 1970, 73, 78, and things have developed a lot. So health has got the challenge, that particular challenge. So we hope the minister, the new minister, since she's a nurse also, she understands things from health, she can sit around with the people who can advise her and from health fraternity to analyze the laws. We had already started to say from the parliament, say, can we analyze what laws are not there? So fortunately, law reform recently, I think they are in that area to see that the laws can be reviewed, to check which ones to be repealed, which ones to be amended, which ones to be redone altogether because of the times. Yeah, so I would say the issues of mental health can be dealt with, and it would have been good because while we don't have a clear statistics that I have in my head now in terms of the prevalence of that, but it could be very much helpful to deal with it while we can see that while it's prevalent, it's there, but it might not as bad as other places.